Did you know that nodding your head can actually evoke feelings of happiness within you and those around you? Or that shaking your head no can actually make you less confident in your own thoughts? These seemingly simple, mundane actions are actually quite the opposite. They involve highly specialized bones working together in an intricate manner. The atlas and the axis are two amazing bones within the human body that allow you to do these fascinating actions. The vertebral column of an adult is composed of 26 individual bones, 7 in the cervical region, 12 in the thoracic region, 5 in the lumbar region, and 2 sets of fused vertebrae in the sacral and coccygeal region. Each region of vertebra is specialized for specific actions, causing them to look reasonably different from one another. Two very specialized bones of the cervical region are called the atlas and the axis. The atlas and the axis have no intervertebral disc between them, and they look strikingly different than the rest of the cervical vertebra. The atlas, otherwise known as the C1, has neither a body nor a spinous process. It appears to be simply a ring of bone with two transverse processes and two transverse foramen. Each transverse process has a superior and an inferior facet. The superior facets of the transverse process articulate with the occipital condyles of the occipital bone, which allows for flexion and extension of the neck when you nod your head yes. This joint is called the atlanto-occipital joint and is a synovial joint. The atlas articulates with the axis on the inferior facets of the transverse processes, forming the atlanto-axial joint. The vertebral foramen is very large, as it holds both the brainstem and the spinal cord. The name Atlas comes from the Greek god Atlas, who held up the world, just as the atlas holds up the skull. The axis is the second cervical vertebra, otherwise known as the C2. Has all the traditional features of a cervical vertebra, including a body, spinous process, and transverse processes. The most specialized feature of the axis is the dens or odontoid peg, which is a process that rises perpendicularly towards the atlas. The dens is secured to the anterior arch of the atlas by the transverse ligament of the atlas. The joint formed between the atlas and the axis is called the atlanto-axial joint and is a pivot joint. This joint allows us to rotate our heads left and right, such as when we shake our head no. The atlanto-axial joint is held together with two main ligaments, the anterior atlanto-axial ligament and the posterior atlanto-axial ligament. The anterior atlanto-axial ligament runs from the lower border of the anterior arch of the atlas to the front of the body of the axis, stabilizing the anterior portion of the joint. The posterior atlanto-axial ligament attaches to the posterior arch of the atlas to the upper portion of the lamina of the axis, stabilizing the posterior portion of the joint. These ligaments strengthen the articular capsule of the atlanto-axial joint, which connects the lateral masses of the atlas to the articular facets of the axis. Injuries involving the dens are usually fatal. One such injury is severe head trauma. During severe head trauma, the head is pushed inferiorly towards the spine, causing the dens to be driven into the brainstem. Another fatal injury involving the dens is fatal whiplash, in which the neck is violently pushed forward, sending the dens posteriorly into the cervical spinal cord. A third example is when somebody is executed by hanging. During the hanging, the neck is jerked backwards, causing the dens to actually break and hit the lower portion of the brainstem. The brainstem controls basic functions of life, such as breathing and heart rate, so any injury to it is likely fatal. To review, the two uppermost cervical vertebrae are the atlas and the axis. These vertebrae help support the neck and protect the spinal cord, as well as giving us the ability for full range of motion, such as rotation right and left and flexion anteriorly and hyperextending posteriorly.